Oh, hello there! Hello nurses and hello world! This is nurseniezl and welcome back to my channel.
This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice.
Oh, so you all know what we're going to do today. It's about VIP or Visual Infusion Phlebitis or VIP score and IV cannula flashing. Okay? But before we get into it, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Also, comment down below what other videos you want me to do next, okay? VIP score and IV cannula flashing is one of the new skill stations in the OSCE exam. You have to do this procedure within 12 minutes. And that's what I'm going to show you all today. In order for you to pass, you have to administer the IV medication safely. Yes, you heard me. IV flashing here in the UK is an IV medication administration. That is why it has to be prescribed. You have to remember our 5 R's, the 5 rights of the patient when it comes to administering medication or when it comes to taking their medication. Right patient, right medication, right route, right dose, and the right time. So remember to do your full ID check. You must also complete the documentation in the prescription chart. You will receive different prescription charts, okay? It depends on where you are, whether you're in a hospital or you're in the community. Today, we're going to just use a hospital prescription. Since we are dealing with an intravenous cannula, IV cannula, make sure to use an aseptic non-touch technique. Meaning, in this procedure, please do not contaminate the sterile areas, otherwise you will fail. And you don't want that, okay? And before flashing the IV cannula, you have to perform a VIP or Visual Infusion Phlebitis score assessment. And the question in your mind probably is, what is a VIP assessment? What is VIP? As you all know, the insertion of peripheral intravenous cannula or PIVC for intravenous fluids or IV fluids and medication is the most common procedure in hospitalized patients worldwide, not just here in the UK. Now, a frequent PIVC, frequent peripheral intravenous cannula complication is phlebitis. Okay, remember that, phlebitis. Phlebitis, that is the inflammation of the vein, which may be mechanical, chemical, or bacterial origin. So nurses, this is why the VIP scoring was developed. VICC research indicates that the Visual Infusion Phlebitis score is a tool for monitoring infusion sites. So that determines the appropriate discontinuation of the peripheral intravenous catheters. Take a look at this one or the screen. I'm going to put it in the screen. This is what it looks like. Okay, this is our VIP scoring chart, okay? You can see from the screen, the VIP scale provides a score from 0 to 5 in ascending order of severity of the inflammation. Each grade identifies a more advanced or a less advanced state of phlebitis or thrombophlebitis. Let me just explain to you the different signs of phlebitis, okay? This is an example of an IV cannula site, okay? As you can see, the site appears healthy and there is no signs of phlebitis. So meaning, according to the VIP score, the score should be 0. So what do we have to do? What is our action then as nurses? Only continued observation of the cannula is indicated. So this, nurses, is a score of 1. score of 1 in which one of the following signs is evident, okay? Slight pain or slight redness near the IV site. Again, slight pain or slight redness near the IV site. So that would be the score of 1. Okay, what does it mean? It means that there is a first, according to here, there is a first possible signs of phlebitis, okay? So what do we have to do as nurses? It will be simply necessary to continue with the monitoring, okay? Again, it is necessary to continue with the monitoring of the IV cannula site, okay? So this one right here looks exactly the same of what is the score of 1. The only difference is that the score of 1 only have either pain or slight pain or slight redness on the IV cannula site. But this time, this is now a score 2 because 2 of the following signs are evident in the site. Pain at the IV cannula site and redness or swelling is evident. Okay, again, it looks like the same, but it differs because this time there's 2 evident signs, okay? Like I said, this is now a score 2, and now this is what we call the early stage of phlebitis. So as nurses, what do we have to do? Okay, this IV cannula requires a repositioning of the cannula this time. So what do we have to do is to resite the cannula. We have to reinsert it on the other area, okay? So this site is looking crazy. So it's now a score of 3. Why? All of the following signs of phlebitis are present. What are those? There's pain along the path of the cannula, redness around the insertion site, and then obviously there is swelling. So as you can see from the site right here, this is now a score of 3. So what do we call that now? We are now at the medium stage of phlebitis. So as nurses, what do we have to do? We have to again reposition or resite the cannula elsewhere, and you have to consider treatment, okay? Because there's a phlebitis going on right now, okay? So we have to start the treatment for this site, and we have to resite the cannula again, all right? This, ladies and gentlemen, is the score of 4. Why? Because all of these signs are now evident and extensive. So what are those signs? Again, we have the pain along the path of the cannula. What else? Erythema or redness. We got redness, yeah, extensive redness surrounding the cannula plus the swelling, and obviously we've got now the number 4 sign, which is the palpable venous cord. Palpable venous cord is the firming or the hardening of the veins, okay? I got another picture right here. This is what it looks like, okay? In the real scenario, obviously, I just draw this one, obviously. So the signs that you can see here is also from the score of 3. The only difference is that this has another score, another sign, which is the palpable venous cord. That's the only difference between the VIP score 3 and the VIP score 4. Again, the only difference is the palpable venous cord, okay? So again, like I said, this is now the score, a VIP score of 4, which means that this is now the advanced stage of phlebitis, okay? Or the start of thrombophlebitis. So what do we have to do as nurses? Again, we have to resite the cannula and then consider treatment for the phlebitis, okay? Oh yeah, as you can see here, it's the same picture. It's the same classification with the VIP score 4, but this is VIP score of 5. Why? Because this time, this stage, they included pyrexia. So you have to ask here if the patient is having fever. You have to ask here the patient's temperature to know if the patient have fever or hyperthermia, okay? The only difference again between VIP score of 4 and VIP score of 5, the patient is having already a fever on this kind of stage. This is now what we call the advanced stage of thrombophlebitis. Again, VIP score of 4 is the start of thrombophlebitis, but this is a score of 5, which is this is now the advanced stage of thrombophlebitis. Okay, that's the difference. What do we have to do as nurses? What do we have to do with this one? Again, we have to resite the cannula, definitely. Remove this cannula, resite it on the other area, and initiate treatment. Okay? Initiate treatment. Patient is having a fever now, high temperature, hyperthermia. The patient is having infection. Okay? Again, initiate treatment. Clearly, it is important that the detections and interventions are always documented. Remember that, nurses, documentation is very important. This is for an effective monitoring and prevention. Okay? Now that you know how to do a VIP assessment, you're now ready to do an IV cannula flashing. Please click the next video for part 2. So, if you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post new videos, then hit the notification bell. Also, comment down below what you like about this video and what you don't like about this video. Also, comment down below what other videos you want me to do next. This has been nurseniezl. See you on the next one. Bye!
Hello.